Hypertension by Rhea, Alex, and Rachel. Scenario. Bill is a 67-year-old overweight male that was diagnosed with hypertension. The doctor explained that due to him being overweight, his high sodium and fat intake diet and age all increased his susceptibility to developing hypertension. Hypertension is described as abnormally high blood pressure, usually starting at around 139/89.
Risk factors. Decreased blood vessel diameter due to plaque buildup in blood vessels caused by a high-fat diet, increased blood volume due to a high-salt diet, and an aneurysm due to an increased pressure in blood vessels. Symptoms. Aneurysm, weakened blood vessels in the brain. Cell membrane is weakened due to excessive pressure in the vessel. Enlarged and weakened heart may lead to heart failure. Homeostasis is affected because blood is not able to be pumped around the body due to weakened cardiac wall. Vision problems or blindness. Homeostasis is affected because visual sensory input is not able to reach the brain. There is a lack of information exchange between the retina and the brain through the optic nerve, cranial nerve 2, which becomes damaged due to lack of blood flow caused by plaque buildup in the vessels. Normal physiology. Blood pressure is related to the force and rate of the heartbeat and the diameter and elasticity of the artery walls. End diastole volume, also known as EDV, regulates blood pressure. EDV is the amount of blood at the end of filling of ventricles. EDV regulates blood pressure by controlling how much blood is pumped into both the pulmonary and systematic circulatory systems. Kidneys monitor low blood pressure. When homeostasis isn't reached, the kidneys produce renin, which is combined with angiotensin in the blood to form angiotensin 1. Lungs then produce ACE, which is an enzyme called angiotensin converting enzyme, which turns angiotensin 1 to angiotensin 2. This then goes to the adrenal cortex, which stimulates the adrenal glands to secrete aldosterone. Aldosterone goes to the kidneys to stimulate the kidneys to reabsorb salt from urine, then water follows, which allows the blood volume to increase, which increases EDV, stroke volume, and cardiac output. Strength of contractions and heart rate affects blood pressure because it controls the amount of blood being pumped into the systematic circulatory system. Increased heart rate causes a decrease in oxygenated blood, leaving the left ventricle because it doesn't have as much time to fill.
Pathophysiology. Increased blood pressure can be caused by a decreased diameter of the blood vessels. When plaque builds up in the artery, it increases resistance and narrows the diameter of the blood vessels, causing an increase in pressure. A high salt diet causes an increase in secretion of aldosterone. This is because there is a high overall concentration of ions within the blood, so the body tries to return to homeostasis by diluting the blood concentration. Aldosterone causes reabsorption of salt into the bloodstream from the urine, which causes water to follow, thus increasing blood volume. Increase in blood volume causes an increase in the resistance in the blood vessels, thus increasing overall blood pressure. When EDV is increased, there is more blood leaving to both pulmonary and systematic circulatory systems. The increase of cardiac output causes an increase in blood pressure.
Diet. The patient was advised to reduce sodium in his diet and increase his daily activity. This will help him lose some weight and thus decrease his blood pressure.
Latest research. Dr. Ho and associates use thiazide, which is a diuretic, as a first-line therapy for clients with incident hypertension. Research found that clients that use thiazide as a first-line therapy for their hypertension notice gradual decrease in overall blood pressure over the years of 2002 to 2007.
Created using Powtoon.